topic that's very important to consider is the idea that when a child goes on to an opioid or a narcotic for chronic pain, one of the first things out of a parent's mouth is, oh my gosh, is my child going to be an addict or drug addicted? And this is a really big and common concern that we understand that you have about your child's addiction. But it's very important to recognize that drug addiction is very different than what we talk about with regards to medication dependence. So yes, if your child goes on to a medication like a narcotic or an opioid for pain management, their bodies will become physically dependent on that medication. And that does happen. That's very different than drug addiction. Drug addiction is when your child's running around behaviorally stealing money or taking things or dropping out of school to then sell those things or to go find drugs for their habit. That is a very different thing, drug addiction. But being physically dependent on the medication is something that will happen to your child. Now, this is what you need to do, is work closely with your medical team. That's number one. Number two is only get your medications filled from the same doctor. So if you're going back to the same doctor to talk about how the pain symptoms are getting better or they're worse, and that person is prescribing your medications, you should have no problems with any kinds of addiction that you are initially concerned about. So working with the same doctor and making sure that you're taking the prescription as follows will be no problem. And then actually over time, if your child comes off medication, then the same considerations have to apply. You have to work with the doctor. You can't just stop the medication cold, because then your child will go through something called withdrawal. And that's a really bad thing that you don't want your child to go through. You want to make sure that the same way that they started the medication is the same way they come off the medication, so that a doctor can then wean your child. They say wean, which is to take your child off the medication slowly so that the child doesn't go through a withdrawal experience. So that's really critical to remember. So you're working closely with your medical team to make sure that you're following the medications as prescribed for the child's chronic pain, and then you won't have to worry about any kinds of drug addiction. But it is important to understand what is the body becoming physically dependent on the medication, and that will happen, which means that you have to work closely with your medical team to either be on the medicine or to come off of the medication in order to manage your child's chronic pain symptoms.